When a patient first comes to me with peripheral neuropathy, I'm going to sit down, I'm going to have a consultation with them. We're going to discuss their family history, if there's any genetic components involved. We're going to discuss what medications they're on, if they're diabetic, if they've had any surgeries in the past. We're going to really kind of flesh that all out. Then we're going to do what's called an advanced neurofoot analysis. So we're going to analyze all the small fiber nerves in the legs and feet, and we're going to see how much damage is actually in those nerves. So if you're supposed to be feeling at 100%, do you feel 80% or do you feel 46%? Because there's a big difference there. And it changes the prognosis, and it changes ultimately how we're going to treat that patient. We're also going to do a circulation test called the photoplethysmograph, and we're going to look at how well those blood vessels are opening and closing. So how well are those blood vessels nourishing those nerves in the hands and feet. And based on all of that data, we're going to put that all together, and I'm going to come up with an individualized treatment plan to address that patient's specific needs. And we're going to determine, is this a case that is going to be, is it going to respond to the kind of treatment that we do? And if it is, then great, we'll progress with treatment. And if it's not, then we're going to make some recommendations for the patient as to what might be their next step.